Hey, it's Raj from 3CB Performance. COVID-19, aka novel coronavirus, has essentially shut down the sports world for the indefinite future. To get a better understanding of the virus and its impact on sports, I consulted closely with a trusted epidemiologist and infectious disease expert to shed light on the subject. In this video, I used the expert's medical insight to explain why leagues and sporting events were shut down, if athletes are at higher risk, and when leagues may fire back up. With the ongoing spread of COVID-19, nearly all major sporting events and leagues in the world have been postponed and gone on hiatus. Initially, it seemed that leagues were considering playing without fans present in the arenas, but once direct personnel tested positive, like Utah Jazz center Rudy Gobert in the NBA, Arsenal manager Mikel Arteta in the Premier League, Juventus center back Daniele Rugani, the sporting world realized the true gravity and seriousness of the situation. It was absolutely the right move. These postponements and cancellations are critical to stop the spread of COVID-19 because small gatherings, let alone 20,000+ people, are a breeding ground for spreading the virus, and then all those fans, players, staff, coaches, etc. potentially become vectors themselves to spread it to their family, friends, and communities. Large gatherings are basically the last thing you want to do during a pandemic. It's critical to break the chains of transmission via social distancing, especially in the early stages. For more on that, you can watch the previous video that I made, or even better, check out the Center for Disease Control CDC website or World Health Organization WHO website. Athletes may be at more risk for picking up COVID-19 because high-level athletes are often immunosuppressed during the season due to the high quantity and intensity of physical and mental activity, fatigue, constant changes in sleep and schedule, and generally a very high stress environment, particularly for top-tier teams and top markets that come under heavy scrutiny, media coverage, and relentless microscopic overanalysis. Further, athlete, staff, and team personnel are potentially at higher risk simply due to a higher quantity of exposure to potential vectors for COVID-19. Examples include interactions with fans and media members, and thousands of high-use touchpoints, door handles, bathrooms, etc. while traveling for games. Even players' families may have more interaction with the community at large, which results in potential transmission risk back to the player. Additionally, players, staff, and personnel are often in confined group settings, such as team meetings, locker rooms, training, traveling, and partake in meals together, which further increases potential exposures and spread. All that being said, elite athletes still typically have resilient immune systems due to their overall fitness, health, and younger age, which means even though they may be infected, it's highly unlikely they'll have severe symptoms. Additionally, athlete staff and personnel have access to early COVID-19 testing and elite concierge medical care, which further limits any probability of developing severe symptoms. To that point, the NBA's Utah Jazz were immediately tested for COVID-19 while in Oklahoma City after Gobert's case came back positive and used up nearly 60% of the state's daily testing capacity. Further, Arsenal manager Mikel Arteta had access to a COVID-19 test even though he exhibited only minor symptoms. There's numerous other more recent examples, like Kevin Durant's testing positive, but we've yet to hear of any athletes with serious symptoms, which lines up with the risk profile for COVID-19, which really hits people over 60 and or those with underlying conditions the hardest. There are so many variables still in play, so the only viable answer is simply we don't know. For example, let's say players, staff, personnel, and close contacts all go through an extended quarantine, come back with negative COVID-19 tests, and all touch points, stadiums, training grounds, homes, transport, etc. are thoroughly disinfected. If that's the case, you still have to wait for COVID-19 to play its course in the general population, otherwise you again risk lead personnel becoming infected. And that timeline depends on how stringent and proactive government quarantine and isolation mandates were and how quickly testing capacity increased to isolate and quarantine hot zones. For example, the Chinese government mandated strict quarantines and significantly ramped up testing, which has led to a significant decline in new cases. Accordingly, the Chinese Basketball Association plans on returning behind closed doors in the first week of April, approximately 8 weeks after being suspended on February 1st. However, Western countries haven't gone to the same lengths, which has led to very similar COVID-19 case trajectories as Italy, which is now considered the epicenter of the virus. In the US, the CDC is recommending 8 more weeks of no events with greater than 10 individuals, and multiple states and counties have issued 3-week mandates shutting down all non-essential activities. With that timeline, a best case, albeit unlikely scenario is that the NBA and MLB start up in mid-May. However, according to recent reports, the NBA is eyeing a return at some point in June, with the league searching for arenas, possibly practice facilities, through August. If the UK follows a similar route, that's essentially the rest of the normal club season on hiatus. However, UEFA has announced the intention to be finished with all domestic tables and club competitions by June 30th, but that sounds extremely ambitious. Accordingly, it has moved the Euro Cup and Copa America to next summer. Unfortunately, like many things when it comes to medicine and disease, league return dates are truly a fluid, wait and see scenario. When leagues do get back, fully expect for the games to be played without fans and with essential personnel only for the foreseeable future to guard against any reintroduction of COVID-19. Further, I imagine the leagues will continue to monitor and mandate strict distancing measures for player, staff, and personnel, possibly with family as well, until COVID-19 has completely run its course in the general population. You have to have an abundance of caution or risk another shutdown. COVID-19, aka novel coronavirus, has placed sports on the back burner and the safety and health of the world population at the forefront. It's a situation that needs to be taken very seriously, and we're seeing sports administration and federations do just that. We'll assuredly hear of a number of athletes who become infected with COVID-19, but they'll more than likely only have mild symptoms. Their larger concern is if any of these athletes came into contact with and potentially spread the virus to high-risk populations. In addition to potential governmental mandates, each and every one of us can follow experts' advice and limit our own exposure to COVID-19 via social distancing and fundamental sanitation measures to break chains of transmission. I know we're all bummed about the sports hiatus and rearrangement of calendars, but those are small blips in the grand scheme of things. Stay safe, stay calm, stop hoarding water and toilet paper, stay in control of what you can control, and possibly use this relative downtime to reset and work on habits such as sleep hygiene, fitness, nutrition, reading, reaching out to family and friends, and so on. These are difficult times full of change, but it's short-term sacrifice for the long-term good. We'll get through this and have a newfound appreciation for sport that only seems to come from having it taken away. That's a wrap for this video. Thanks for watching. My goal is to provide you with in-depth, evidence-based, narrative-free analysis, and you can always find me on IG and Twitter at 3CB Performance. Make sure to sub to the channel and follow along on all social media for the latest updates. Take care of yourselves and be cognizant of others. We're all in this together. 3CB out.